over the last decade or more, there has been a shift towards recognizing colorectal cancer developing in younger and younger patients. This has resulted in most task force and recommending bodies to recommend the introduction of colorectal screening earlier than was the case. So it is now recommended to start at 45 years of age, all other risk factors being the same. 45 years of age is the age that we recommend for people with a so-called average risk. But obviously for patients with a family history, they need to take into account the age of the family member. So if the family member was, for example, 45 years of age at the time of diagnosis, then the recommendation tends to be that other family members should start 10 years younger than that age.
The American College of Surgeons National Cancer Database, as well as the SEER database, have really pointed to about a 1 to 2% annual rising incidence ever since 1970, in the mid-1970s. The rise is disproportionate in terms of higher rise in the distal colon cancers and rectal cancers among the young patients as compared to other parts of the colon.
I see patients time after time, and it never ceases to amaze me that they've had symptoms for a long period of time, and they either choose to ignore the symptom, or even sadly, their physician attributes that, because you're young, it must be hemorrhoidal disease. And even healthcare professionals, I remember a nurse, she was 28 years old. She told me she was having symptoms, and I told her she needs to be scoped. And she waited about a year from the time she started having symptoms, and unfortunately, she had rectal cancer. And so this happens even within our, health profession, nurses, doctors, that just think it's attributed to a benign disease, and we shouldn't assume that. We need to get checked.